Hi everyone. Once again, Dr. Peterson here with Regions EMS for today's COVID Daily Update. Today is Monday, April 13th, 2020. We've made it this far. We still have a ways to go, but we are seeing some progress. Information presented today is current as of today, April 13th, and we make no guarantees that it will be current later this week or even tomorrow. Please stay tuned to our website, regionsems.com. Click on the COVID link. You'll see a page with resources and a date as of when we last reviewed and updated the information, so you can be sure you're getting the most recent information that we have available. Thanks for all you do. We made it through another weekend, snowstorm and all. Couple facts for today. Worldwide, there are just over 1.8 million confirmed COVID-19 cases, with just over 116,000 confirmed deaths. So it's just about a 10% mortality rate based on the confirmed cases, and we know that that's an underestimate as far as the confirmed cases, which means that the mortality rate is an overestimate. In the United States, we have over 557,000 confirmed cases with just over 22,000 deaths linked to COVID-19. Here in Minnesota, we surpassed the 1,600 mark, and we have 70 deaths attributed to that. Wisconsin has pretty much doubled Minnesota with just about 3,300 confirmed cases and 144 confirmed deaths. We'll see what the next couple weeks brings. I think this is kind of the telling time here when some of the models predict that we're going to see our surge or our spike. Some of them, again, are kind of flattening that curve and stretching this out into the early summer months. So I think the next few weeks are going to give us some good information as to what to expect over the next month or two. I don't have a lot to discuss today. And I think information is starting to slow down a little bit, so we will be transitioning these videos to, for sure, weekly, possibly more often if needed, but we're not necessarily going to be putting these out every day or even 3 times a week. We'll just kind of see what information is out there and needs to be communicated. So for today, just a couple things. First of all, MRCC has implemented the new report format, and I've heard many of you using that. They want to know your patient's age, gender, chief complaint, hospital destination, ETA, and a triage color, either green, yellow, or red. Once they acknowledge you, then you just give a very brief one-liner as far as what's going on. We don't necessarily need a full report with all of the details. You may be asked some questions such as blood thinner usage, COVID screening questions, seizure histories, that kind of stuff. But in general, the goal is to limit the duration of our MRCC reports so that we leave the airwaves open. So we have a document posted on our website that describes this a little bit more. And obviously, next time you give your report, try it out and see what the operator thinks. All right. Also, we posted this last Friday, but we have a risk exposure guidance document for public safety professionals, which talks you through assessing the risk of an exposure you may have had, whether it's from a patient who maybe coughed in your face or even was just positive in the back of your ambulance, or a coworker at your station who tested positive for the virus, or a family member. There's a document that describes how to stratify the risk and then what to do about it. Do you need to be quarantined? Do you need to stay home from work? How can we monitor you to make sure that you are not infecting other people? And then 2 other things. One is that 3M has been doing some work with Regions Hospital to look at reuse and cleaning or re-sterilization of the N95 masks. They do have some promising data. However, it requires some specialized equipment at this point, so it's not necessarily widespread. As more of that information becomes available, we will make sure that you are aware of that so you can know how safe it is to reuse your masks beyond a single shift. We'll get some guidance on that once we have that available. And then finally, one question we've received is what happens if we transport a patient who's suspected of COVID and then they test positive? How are we going to find out about that test result? And that's a very good question, and we are working very hard, even at the state level, to try to make this something that is on everyone's radar. For sure within Health Partners, we are working on a mechanism to make sure that EMS is included in the notification, in addition to obviously the healthcare workers from Health Partners who were exposed. But we would like to see this on a more broad level at the state level. Right now, the state has asked or required that allow positive patients be released to dispatch centers so they can flag addresses when you respond. But obviously, we'd like to know for sure if you transported a patient and they did test positive, we want to get that information back to you so you can assess your risk and then determine with your agency's leadership what needs to happen. Like I mentioned on Friday, as long as the patient is wearing a mask, the highest risk that you would have is medium, which means that you do not need to quarantine from work. If you're wearing full PPE, then the risk is even lower than that. So again, I can't stress enough the importance of using your PPE, being familiar with doffing and donning practices, and just doing the right thing, using some common sense. All right, that's all I have for today. Let's go back to last week's trivia question, and the question was, which infection in recent history has the highest R0 value? The R0 value, again, is a indication of the infectiousness of an infection of either a bacteria or virus. And the higher the number, the more likely it is to be widespread and cause a pandemic. Had several replies. We had Nate from Lakeview EMS, John and Josh from St. Paul Fire. First two submissions from St. Paul Fire. Thanks, guys. Andy submitted from MRCC on behalf of Roberta. And then Chief Glazer and Linda. Chief Glazer from Stillwater Fire, Linda from Northland Ambulance are kind of our two regular submitters to this. Most people assume that measles has the highest R0 value, and I would agree with that. Most estimates place the measles R0 value between 12 and 18. For comparison, the seasonal flu is maybe around 2, just under 2. The COVID-19 R0 value is estimated between about 2.2 up to maybe 5.7. It's probably a little bit on the lower end of that just because we are not detecting all of the confirmed cases because of our testing availabilities. But measles is a very infectious disease, which is why a vaccine was developed and why it's such a big deal. Why it has come up in recent years as there's been some little pockets of outbreak amongst unvaccinated populations. I'm going to address Roberta from MRCC. She guessed malaria, and I think, Roberta, you may have one up to me again. I probably need to do a little bit more research before I post my next question, because this is twice now that I've been overridden. Malaria actually does likely have a higher R0 value. Some estimates put it as high as 3,000. The difference is that malaria is not transmitted from human to human. It's transmitted through mosquitoes. So we don't have to worry about it here in Minnesota or really in the United States because we don't have the mosquitoes that carry malaria. But in an area where the mosquitoes do carry malaria, a mosquito that bites an infected person, that person could potentially, with all the mosquito bites they might experience, infect up to 3,000 other people, which is why malaria is such a worldwide problem in those areas. So thanks, Roberta, for bringing that to our attention. Thanks for the rest of you for submitting your answers. Because we're going to move the frequency of our videos, I don't have another trivia question for today, but what I thought would be interesting is to see how far and wide these videos are reaching. So if you could, just take a quick minute, email us at regionsems@healthpartners.com. Just let us know your agency, where you're from, and if it's available, if not, that's fine, but just send us a digital image of your agency's patch, and we can maybe start a virtual patch board on our website just to show where people are from, who's watching these videos, and we get a better sense of who we're reaching with this information. So thanks for all you do. We'll see you later this week, hopefully. We'll keep you up to date if anything changes. Other than that, stay safe, stay healthy. We'll see you later.